The phrase "mind the gap" is commonly heard in London train stations to ensure passenger safety when stepping from the platform into the train. Today, I wish to convince you to not only mind the health gap that has callously rooted our society, but to close it off altogether. Recently, I took a health course here at BYU where I learned that there is a true discrepancy between men and women's healthcare. And having recently experienced a difficult miscarriage myself, I have quickly become aware of how uneducated we are on these women's health complications. And this issue is for each of us, whether female or not. We all have mothers, sisters, and wives. And as BYU students, we are entering into a stage of life where this topic matters more than ever before. I will first state evidence to show that women are receiving less medical focus and end with how we can close this gap. So first and foremost, there is a health gap. Dr. Richard Brull, a professor from Women's College in Toronto, shared that women are often overlooked when it comes to health research studies, yet they have different risk factors for certain diseases and may respond differently to various treatments and medications. Dr. Stephanie Lutz further shared that many prescription drug therapies and treatment protocols still used today have been disproportionately studied on men. In addition, the American Medical Association has shared that before the 1990s, 12% of physicians were female. Now, today, 33% of physicians are female. This is a great step forward, but it is still not enough because we need more female physicians. Because in fact, Duke Health stated that 1 in 5 women have reported that they have felt as though their health issues have been either dismissed or ignored. And what better way to help women than to have physicians who can relate? So now that we understand that women are receiving much less medical focus, we must remember that they have vital health issues. First, menstrual health. Recently here in Utah, a bill was passed that allowed menstrual health products to be put in our local junior and senior high schools. And this is a great step forward, but should be put into colleges and our public places. The World Health Organization said that this is a human rights issue, not a hygiene issue. Second, birth control needs to be better taught. Despite our common familiarity with the condom, the IUD, and the pill, there is a wide variety of other options that most people do not know about. And third, birthing care must reach the educational level. Most pregnant women and their partners do not know the advantages and disadvantages to different birth settings or even labor pain management helps. And so we can see that there is a clear problem. This is a local problem. It is a state problem. This is a worldwide problem, and people we talk with and walk with need support. So may I suggest 3 ways in which we can begin to mitigate this health gap? First is by empowering yourself with knowledge. This can be done by conducting your own research or by enrolling in Health 450. Second, we must not shy away, but we have to choose to talk about these health issues. It is more common than we think. And third, know the healthcare that's available to you. Some specialized care, such as mammograms, are free of charge under your health plans. As we continue forward and try to live and take on these 3 suggestions, we will begin to repair the echoing health chasm that separates women from men. Thank you.